Well, good evening, everybody, and welcome to BioTouch Healing Health Condition Workshop on tennis elbow. My name's Paul,
Good evening. This is Bev.
and we have a special guest with us today, Julia Darrah. Did I pronounce that right? Darrah?
It's Dara, but
Darrah.
Dara works
Hey,
too.
Darrah,
Yeah.
we want to do
Thank
it right.
you.
And she is a certified personal trainer. I guess she'll tell us about that. So she's going to share with us all about tennis elbow. If you have any questions for her, you can always type it in the comment. We'll pass it on to her. And if you need the workbook, you can go to justtouch.com/workbook, because after Dara's presentation, we're going to teach you how to do BioTouch healing for tennis elbow. So Dara, we're just going to let you take it away.
Okay, thank you very much, Paul. Again, my name is Julia Darrah, and I have been a certified personal trainer since 1999. And I specialize in working with folks over 50. However, I do also work with people of all ages. It's just I have always kind of gravitated to people 50 and over. And now that I'm in that category, it makes even more sense to me. I've been training folks and doing the personal training, which is, we have the PT after our names, CPT, Certified Personal Trainer. So sometimes people will get that mixed up with physical therapist, and I don't want you to do that. Physical therapists are definitely a different category of folks that help people with different physical limitations and things that they need to work on in their bodies. They're doctors. I am not a doctor, so just remember that. And my training has included specialty training for working with people with different limitations, such as Parkinson's disease and brain injuries and sort of things like that, along with the everyday injuries or muscle imbalances or things that they want to do to strengthen their body or get into better shape. So I have worked with lots of different people with lots of different things going on very successfully, helping along the way. The thing that I like to do is emphasize that whatever you do as far as exercise, you want it to sort of relate to what you do on a daily basis. So if you are an athlete, then you're going to train way differently than if you are somebody who is 65 and active, but not doing any competitive training or activities that would require special training. It's very important for you to find a trainer that is going to be someone who really knows what they're doing with you and takes their time to gather your health history and your goals, and then also takes into consideration, maybe you don't know your goals, but how to find those goals for you and guide you in that direction. I always do a consultation with my people free of charge to discuss what they're looking to do, as well as how I train. And if it's a good fit, obviously, then we go forward. But it's always good to have those initial meetings to find out if you're actually going to be on the same page, or if you feel like you're going to gel, so that you get the most out of your training session. Not only that, but your money's worth, right? You don't want to pay for something that you're not really going to get anything out of. So with that, I also do corrective exercise, which is kind of a new, not real new, but for the general public, it is a new part of personal training, where we actually go in to do the assessments on people, movement assessments, to find out how their body is moving and what is causing some of the issues they're having. And then we address them in a certain order as far as how to treat it and to build strength in certain areas, et cetera, and then create better balanced muscles. And I'll go into that a little bit more detail as we talk about the tennis elbow. most of my clients are looking to build strength or to alleviate some pain that they're having. It could be sciatic pain, it could be knee pain, hip pain, other than sciatic, elbow, shoulders, necks, whatever. And with the corrective exercise curriculum, it is a really great way to find out why they're hurting and to help them get out of pain and to build strength properly so that they stay out of pain and know how their body can work correctly the way it's supposed to once we get the correction done. So sometimes corrective exercise will not alleviate the pain. So don't think that that's the end all be all, because of course, everybody is different. Every situation is different. But once we do the assessments and we start in on a corrective exercise program, if their pain isn't alleviated in some way, whether it's very small or a lot, within 2 to 3 weeks of starting the program, we may know that there's something else going on that can't be corrected by exercise, and then they get referred to a physician or another healthcare provider. So again, I'm not a doctor, so I'm not diagnosing problems, but with corrective exercise, it allows me to really dive deep into why sometimes we have pain and we haven't done anything different. We haven't, twisted a knee, or we haven't fallen, or any of that stuff. So that's why I really, really like corrective exercise, and all of my clients that I'm working with right now really like corrective exercise too, because they don't have any pain anymore. So now we're going to get into the tennis elbow. And funny enough, I don't think I've really had anyone come to me with tennis elbow per se. But that does not say that I don't know how to work with it or help it in my realm of practice. So let me just kind of explain to you what tennis elbow is. We hear that term quite often, and most of the time when you diagnose yourself and say that you have tennis elbow, you're probably right. It's not something that you have to go to a doctor to get a diagnosis. It is caused by repetition in the forearm, wrist, and elbow movement in those areas over a period of time, and doing the same movement over and over and over without changing it up or without supplementing it with other movements to counteract what you're doing. So it's an irritation of the connective tissue between the forearm and the elbow. And you'll feel the pain most likely on the outside of your elbow here. I'll get that up in the picture. And you'll be able to tell pretty quickly if you have it by doing a little grip test. Usually it presents by not being able to grip strongly or having pain along the arm when you do a grip. You can actually test yourself now if you think you might have it. You can keep your elbow bent and then make a fist and then just kind of squeeze tight. And then if you have any discomfort at all, then it might be that. Then also do it with your elbow straight. So you're going to do the same thing, do a grip, and see if that causes any discomfort or feels like it's tight. That might give you a clue. Other ways to know that you're having problems is with trying to supinate your wrist, which means if you want to hold a bowl of soup, you're going to supinate your palm up. Okay. If that doesn't work, or if you're having pain while you do it, that's another good indication that you may have tennis elbow, or that lateral epicondylitis. That's why I don't try to say it too many times. I can't say it. But there's an epicondyle right here, and it's itises. So inflammation or tissue that's irritated. Pain is the primary symptom. So even if you do all of these things and they work okay, but you have the pain associated or along with it, then that is a good indicator that you have tennis elbow. If you also try to grab something wide and grip it, that is also an indicator. So if you have a big jar and you're trying to take the lid off of it, that will also tell you like, oh yeah, that doesn't feel too good. Maybe I do need some help. Then the last thing is your wrist extension. So extending your wrist may cause pain, or it may not work as well. You may not be able to extend it very far. This is flexion, this is extension. So if you are unable to do that without pain, or if it doesn't flex as like it used to, then there may be some things going on in these muscles and tendons and ligaments that are causing that impingement. So what I would do if you come to me and say, hey, I think I have tennis elbow, or maybe I have something going on in this area, I don't know what it is. I don't play tennis. Well, okay, that's all right. A lot of people get tennis elbow and never play 1 minute of tennis. So that's a good point to remember. It's called tennis elbow because that's one of the most common places to get it, but it's just the fact that it's a repetitive motion and doing the same thing over and over and over and over and over without supplementing with different movements. So even if you're not a tennis player, you can have it. So if you come to me with that, what I would do first is I would do some assessments. And those assessments include range of motion, testing in different positions with your elbow and shoulder, and also with the wrist. And they're too detailed to go into right now, but just suffice it to say that I can tell if your wrist will extend or flex correctly with your elbow bent or with it straight. I can tell if your shoulder is causing some of the issues by how your body moves when I do the assessments. The assessments are always keeping your body in movement. So I'm taking you through different motion or movement patterns to see exactly how your body does them. So with the corrective exercise curriculum, any thing that I do, I'll do all of the assessments in all of these things to test your movement patterns. Then I videotape those as well. And then I take it all home and I review the videos, stop and start, freeze, play, all of that, because I'm really analyzing how your body moves and what's happening. And with the tennis elbow, you're going to have some range of motion issues in the wrist. You're going to have some tightness or impingement in the biceps muscles, and also in the shoulder. So when I see your movement, and if you're presenting in a pain in the right side, I will move both sides to compare how they're moving and to see why maybe one side does something and the other side doesn't, or that will also show me why you're having pain on one side and not the other, etc. So then once I find what the issues are, it's going to tell me that you have some muscles that are overactive, meaning that they are doing a whole bunch of work that they don't necessarily need to do. And then there are going to be opposing muscles that are just sitting there not doing anything. They're not doing their job. They're lazy. Okay, so that's how I find exactly what muscles are causing your pain. And then we go into the program where we tell those overactive muscles to stop working so hard. And the way we do that, especially for tennis elbow, is we do some self-myofascial release or some tissue massage just by using your hand. If it's bigger muscles, we use a foam roller. So we would work on hips and the back and thighs, etc., with a foam roller to shut those muscles down, the ones that are overactive. Then once we do that, and it only takes a few minutes, massage the muscle, whatever muscle it is that we're working to shut down. Then we go and stretch those same muscles. So we'll do a shoulder stretch or shoulder stretch this way, So you're opening up your chest because this usually is an impingement here. So these are very tight muscles and they're causing this arm to do this and this and this, and then pretty soon you're all in a ball. So we stretch those same muscles that we shut down. You can do bicep stretches, you can stretch your wrists, lots of different things. But again, it has to be guided, and don't just go, oh, I'll stretch, and then, uh-oh, too much. So then once you stretch, we tackle the underactive muscles by isolating them and giving them some work to do so that they have to work on their own. So, you know, as your body moves, everything works together in synergy, we hope. But when something like this happens, you get pain because your muscles are out of balance. They're not working together correctly. So then we have to go into those underactive muscles, get them to work. And so, for instance, if we're needing to strengthen the extensors in our wrists, then we would place your arm on a flat surface with your wrist hanging off the edge. We would hold a tiny weight, very tiny, and then start lifting. So that's a strengthening exercise for the muscles in your forearm. Okay, those are usually the ones that are not helping out, and that's causing all this other stuff. So that's one way to do it. Again, there are a lot of different exercises, but that's just an example. We're going to wake up those underactive muscles. Once we get those awakened, and we've already shut down the other ones, then we go into what's called integration. And we do usually just one exercise that involves your entire body to train those muscles to work the way they're supposed to all together. So we have the overactive muscles shut down a little bit or turned off, relaxed, and we have the underactive muscles awakened. So they're, oh, let's do this. And everybody's going to work together to get the correct motion patterns, movement patterns working, so that after so many weeks of repeating this routine, everybody, muscles, I'm speaking about everybody, all the muscles in your body will figure out, oh, okay, we can do it much better like this. So these guys are awake, these guys are less active, but still working, and everybody's happy. And then the pain goes away. And then as the corrective exercise continues, because it's not just a one-time thing and done, you must do this for a long period of time, because if you think about it, probably what happened to get to the predicament you're in is you've been doing it for years and years and years and years, right? So now we're not going to have to take years and years and years and years to correct it, but it does have to be over a long period of time of repeating this. There are progressions so that you don't get bored, but we're still shutting down, activating, isolating, and integrating everything for at least 3 months, just to get your brain waves to connect to what you're doing and create those brain maps, so that now your body is working better and without pain. So hopefully that makes a little bit of sense. If you have any questions about that, there I can go into a little bit more detail, but I just want to make sure that you realize that it's not a once, let's do an exercise today and we're done.
Right. Wow. Like we told you when you first came on, we learned something new. I mean, when I've always thought of tennis elbow, I'm always like, oh, there's just a problem with this bony elbow. I mean, it's like
elbow hurts.
Yeah, it's like what? So
Yeah.
So there's a couple of questions that came up for us. So
Okay.
we have some aside. So first of all, you've done BioTouch before. Do you think something like BioTouch is going to help those muscles? I mean, it seems like this is mostly a muscle tendon kind of. Is it related to the fascia too?
Yes, it is. Yes, especially because the wrist and forearm, you don't really think about working them out, but everything is connected by fascia. Okay, so muscles are connected to muscles by fascia. Fascia is the working part of your body. So yes, fascia is a big important part of it. And even though I'm talking about working different muscles, it's all related to how the fascia is working. And that's why we do the first part. We shut down by doing self-myofascial release and getting into those different points where there's some tenderness. So, you know, you're going to be tender right up here or right here, and you're going to shut those down or release them by doing some self-massage, etc. So yes, that's a good question.
So do you think you've had BioTouch? Do you
Oh,
think
and
something like
yes,
BioTouch would help?
BioTouch.
Yeah.
Yes, I think so. I mean, why not? It is, it's one of those things where it's new to me. So
Right.
seeing it in action and seeing how it's helped other people, it's quite amazing. And I definitely, like, I do work with some folks who we do at least the greeting before we start the exercise program, just because we want to get any and all help we can.
Right.
And I think that's a great tool.
You know, what came to me while you were talking is a couple of things. When you talked about repetition, that it has taken the body a certain amount of time to be out of adjustment. It's not going to happen like a magic pill overnight. It's going to take, you know, that you assessing and identifying and then working with it. It takes time. And I think that's a really important thing. We say the same thing about BioTouch. It's this repetition. It's like the body says, I want to have a consistency here so that I really get it. And the other thing was that you talked a lot about everything's connected, bringing the body back into its own sense of wholeness and balance. And the body is intelligent.
It is.
I know I'm just paraphrasing you, but that's what you were saying. And that's exactly what we know when we use BioTouch. I will just say, Julia, listening to you, I want to just say to you that down the road, BioTouch would be absolutely a powerful tool for you in identifying the cause of the pain and actually addressing the pain.
Yes.
So
yeah,
yes, that was wonderful.
And I like the map.
Yeah.
I like how the reconnecting the map, get the brain map. I mean that.
Yes.
That overall, I learned so much. I can't.
Oh, good.
It's like, oh my gosh, you know, it's.
Who knew?
Who knew
Tennis
what you could do
elbow.
for tennis elbow or pickleball
Could be all
elbow?
the way up here.
Yeah,
Right.
or I mean, people can get it just playing with their computer. They could get.
Yes, they can.
Yeah.
So this just opened up a whole new avenue for us.
Right.
Awesome.
This was awesome. So all of you out there, if you want to talk to Julia, her website's there, limseniorfitness.com, and she'd be happy to work with you. It sounds like she's an awesome personal trainer. You do
all us old people. Thank you very much.
People.
And just so you know, LIM stands for Life in Motion.
Life in Motion.
Oh, lovely.
Julia, you're doing great work. We appreciate you taking the time to share with us. So
thank you very much for having me. It's been awesome.
All right.
You have a great evening.
All right.
Thank
See
you.
you later.
Too.
Bye.
Bye.
All right. So we're going to teach you some points now. That was amazing.
Wow.
You know, every time we have a speaker, I can't believe what I learned. I mean, I had no concept it was all muscle and tendons and fascia and you know, it's just
well, you know, that's why education is so important.
Right. You know, we should require all of our practitioners to watch these things because it opens up Pandora's box here.
We've threatened that before, but we've never carried it through.
All right. So what we're going to do is we're going to give you to Bev here. I'm going to play the techie, and we're going to give you the few sets of points, and then we'll even talk about a couple of extras that we didn't put in the manual because we didn't know.
Are you thinking the shoulder set?
Yeah.
Like I am?
So we could actually show that anyhow, even though it's not in the workbook. But if you want to pull up the workbook, go to justtouch.com/workbook, and Bev's going to take us through the sets, and we'll show you the videos with it. So take it away, Bev.
Okay, thank you. And thanks again, Julia. That was a great presentation. So if you do have our workbook, either online or in front of you, if you'll notice, the very first page of our workbooks is always an overview of the condition itself. In this case, it's tennis elbow, and our lovely scribe, Paula Taylor, writes these up for us, and it's very appreciated. She does a great job. So that first page will give you an overview of the condition itself. So if you go to the next page, we will really start to begin, because what we'd like to do is always, for those of you who are new to BioTouch, maybe this is your first time, or all of us who have worked with BioTouch for any length of time, it's nice to be reminded of what this amazing technique is all about. So the first thing is to know is that BioTouch is it's a simple skin on skin touch modality. And we touch very lightly with the first two fingers of the hands, and touching lightly, what we say, lightly like a butterfly on the skin. So that's basically, you've got the tools, got the tools already. So let's go through. There's 4 bullets here that will kind of be a great beginning to learning what BioTouch is. So this first bullet says it's easy to learn, that children can learn it and practice it and be effective. And that is it. That's very true. We've seen it ourselves. Children become practitioners or certified in BioTouch. I always think that BioTouch is this pure, I don't know, this barrier, breaks down all the barriers for all of us. And it comes to us, and we use it very purely in our lives with another human being, like a child. It really takes us out of all of that stuff going on. So there's a lot more to BioTouch. We start on the body. So let's go with the next bullet. BioTouch is a complement to any healthcare program. Absolutely. As in everything else, our language has evolved a little bit. We still say it is a complementary modality, but it's also an integrative modality, in that it works and enhances, whether you're dealing with an allopathic situation, working with a doctor, prescription, or you're working with another practitioner, maybe doing massage or some of the other modalities that are out there. BioTouch is just going to enhance everything. It's just going to help everything. So it is very safe, it is non-invasive, and it will just enhance your healing process, whatever that may be. The next bullet, BioTouch has no levels of ability, and everyone is effective the first time they use it. And we have seen this. I mean, this is one of the great magical things about BioTouch. In order to practice BioTouch, the only thing you really have to have is these 2 fingers and a compassionate heart. You see someone in pain, whether it's a friend or a coworker, a family member, and you are able to help them. There's nothing, you don't have to go through all of this hierarchical, now you're going to the next level type of thing. The minute you learn this technique, you can use it and be effective. I mean, the moment that you do that, for everyone. So everybody's already got the juice, as Paul says. We already have it within us to do BioTouch for each other. That last bullet, it requires no special preparation, no belief, and your state of mind, well, whatever. That means that there's nothing to prepare. Not your environment where you might be working with BioTouch, not your getting the negative energy, you're bringing in the positive, or or preparing a space or yourself, that immediately is taken away. You just step up to another human being and you begin to touch. And tonight you're going to be introduced to the technique itself, some of those sets of points that are specifically touched on the body. Once you learn those, there's nothing that can hold you back. You've got it. There's one or two little things that we do that brings in the integrity and the consistency of BioTouch. We always wash our hands before we touch someone. It's, remember, the definition is one person touching another person lightly on the skin. It takes two people. This is a relationship. We begin every single session with a greeting, which we're going to learn, and you use the first two fingers of each hand and you hold those points 6 to 8 seconds. Wash your hands, do the greeting, touch lightly on the skin, hold 6 to 8 seconds. You got it. That's it. That's all that is required. Paul, is there anything you want to add?
No, I think that's makes it simple. That's what
Yep.
we're trying to present. Just very
That's what
simple
we're here to do,
technique.
make it
Yep.
simple. Okay, so let's go and actually, this page here is really for those who want to learn the whole technique. This is, again, from our manual. And so these terms just help the practitioner to describe the ways that we touch in this technique. The one thing that we do like to point out is these first two, the associate, which is the person who is performing BioTouch, the procedures. We use associate, and we have down here is the dictionary. The role of an associate is one who is inspired to work in the company with another, bringing it into an equality and having an interest in common. Well, this is what BioTouch is. The recipient is the one that is receiving the touch. So again, this is establishing a relationship. We say a relationship of healing is what BioTouch can do for all of us. So let's begin. Let's give you what you are going to need to address tennis elbow, at least right now. So the greeting, as I said before, is always done prior to doing anything else. This is to set up open a relationship with that person. So Paul is going to be showing us the video, and you can watch someone actually doing.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same two fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Paul, you're going to have to give me a heads up when it video's over.
We're done, and just wanted to make sure everybody understood. We have one page that just shows the points and a little drawing, points 1 and point 2. And you'll notice in your downloaded ebook, there's a click here to watch the video. That takes you to the video you just watched. And on the second page of each set is a description of where the points are, and the words in the description are the same as the ones that are on the video. So it's very easy to go back and forth, see the video, read the page where the words are, and it'll take you right to those points.
Yeah, it's a very well thought out teaching tool. It's the only one we have. And this is it. Our manual is it. So let's move on to the next set called the metabolism set. This is to help the body to really assimilate what it needs and get rid of what it is not required. So this could be a lot of different things. And it reminds me of when Julia was talking about the body wanting to assimilate and bring back into a balance all of those things that are kind of out of whack. So again, Paul will be showing the video where you can actually see a practitioner, associate, and a recipient doing BioTouch.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
Okay. Great. The next set, I think we'll do the neck, and then Paul, are you going to show the the video of the shoulder, or what do you want to do? Okay, all right. You will talk about it. Okay, so we're going to learn the neck set, and the reason why you're like, what does the neck got to do with the elbow? But actually, if you look at the diagram, you see those 3 points are, and that diamond at the base, that is what we call the big bone. And this is the source of nerves that go into the head itself, the neck and the head, but it's also the source of the nerves down into the arms and into the hands. So we really want to address the nerves as well as touch those points on the body. So this is why we're going to introduce the neck set. It's very simple and it's very effective. So let's watch the video.
The neck set is used for addressing most headaches, neck pains, and soreness of the upper back. These points are performed in matching fire on the large muscles that run along the back of the neck. Points 1 and 1 are halfway down the neck on the side of the large muscles. Points 2 and 2 are at the top of the neck on the side of the large muscles at the base of the skull. Points 3 and 3 are at the bottom of the neck on the side of the large muscles. As with any set, you may repeat the points as many times as you like. These points may be touched in any order, such as touching points 2, then points 1, and finally points 3.
Okay, so I think we'll show the extremities. So we can talk a little about, because
Right.
that first picture shows somebody, we want to work from that big bone down that arm.
Yeah, absolutely. That's, I was just looking at that. So we have in, the basic technique are these 17 sets of points, but what is offered to the associate is certain things that we can do that can enhance those points in the area that we are concerned about. So we call this extra work, enhancements, and it's, in this case, remember that big bone I was telling you about at the base of the neck, the source of the nerves that run down into the arms. This is, you see a picture of the associate touching that big bone. And then what you would do would put the other 2 fingers around that elbow or even lower on that forearm that Julia was talking about. And this kind of tells the body that you can be working along those nerves. And then you can actually go to that area. If you look at the other pictures on the bottom, you see somebody actually working on a specific area. In this case, it might be around that elbow area, down into the arm, a wrist, whatever. The beautiful thing about BioTouch is, we say, where does it hurt? And that's where we touch.
So let's show that. Let's show that
yeah,
video. Okay.
Definitely.
Enhancements in local work may be performed anywhere extra attention is needed due to disease, pain, infection, rashes, broken bones, cuts, or unusual growths. For example, local work could be performed in an area where there is an unusual growth, such as a mole, matching fire, through fire, sweeps, or hold points. Once again, it is beneficial to address the source of the nerves along the spine that relate to the affected area. In this case, hold 2 fingers of one hand on the big bone area of the neck, and with the other hand touch the wrist. Then proceed with any local work or enhancements.
So that showed you a lot of different ways to touch. It gave you through fires, it gave you matching fires, worked from that big bone down the arm, and as we talked about, she talked about the shoulder. We don't have the shoulder set up here tonight. We'll show it tomorrow. Tune in. On Mondays with Bev and Paul. But if you don't even know the shoulder set, just do some local work. Just all around the shoulder, all those muscles that go down into the arm, front and back, together, matching fire. Like it said, it's uncount. Just do whatever you want.
Just do it.
Yeah.
Just touch. That's why we say just touch.
and if you do a lot of those exercises that Julia talked about, that will give you where the pain or the tightness is. And then you just work in that area. And, I would just have to believe if you did those exercises and then you did some little biotouch, it would you'd find some relief almost immediately.
And that's what came to me when she was talking.
And then, work with your professional like a Julia to really build that muscle and make the ones that are working and get the ones that aren't working to work in. And oh, what a great combination.
I know. Remember, BioTouch is totally integrated with everything.
Yep.
So, it's a partnership.
There you go. It's a partnership. Again, another great little workshop. We hope you all enjoyed it. If you have any questions, contact us, justtouch.com. If you need to get hold of Julia, all the information is there for you to contact her at limseniorfitness.com. She is quite the personal trainer. She seemed very focused.
Very focused, very knowledgeable. Again, another amazing presenter.
And so next month we're going to talk about kidney stones. And we'll probably learn all kinds of new things about that. If you know anybody that wants to be our expert on it, I don't think we have one yet. Otherwise, we'll have to look up some things. But
I'll have to talk to my daughter. She had them, and she said the only thing that moved those stones was when I did BioTouch. She wished that she had continued doing that because she had to have them taken out.
Right.
But
all right. Well, we also have some other testimonials. So check us out next month. And otherwise, we'll see you Mondays with Bev and Paul, or just go online to learn more about BioTouch. We'd love to communicate how to do BioTouch. Good night, Bev. See you later.
Good night, Paul.
And good night, everyone.